So that brain is not functioning normally, and so it's not going to do normal things. Especially the earlier that happens, a lot of times what happens is that the function goes from the abnormal side to the normal side. So even though you have half of it resected, the other side compensates quite a bit actually. So you can still move that other, your other side. You can still have language. You can still have a lot of those things. Especially the earlier that happens, the earlier you have seizures, the earlier those things move to the other side.
Okay. So in the last 5 minutes, you said a couple things. And when you talked about, you mentioned first, if you're right-handed. So one thing you said is that, I believe you said right temporal lobectomy is like one of the safest places for you guys to do.
So what I tell people is that if you have seizures come from anywhere in your brain, the right temporal lobe is the best place to have it come from.
The hippocampus also?
Hippocampus, the right temporal lobe includes the hippocampus and the lateral temporal, everything.
So even though it's mesial, deep into your brain, in the right hippocampal area, it's still, because I've heard a lot, if you get that, it could, affect your memory like too much.
So the right side, again, going back to what I said before, now there are tests that we can confirm that. So some people, it's more concerning when it's on the left side, or if you're left-handed, we worry about right temporal memory. But in general, if you're right-handed, like I said, 98% of people have left brain dominance. Your short-term memory is not going to be on the right side, number one. In general, even in those people where it is on the other side, they often say that their memory is going down anyway, because like I said, when you have a seizure, that's a knock on the brain. That's not just happening there. It's your whole brain is getting injured.
So, say everything you just said, but say it to a left-hander.
So left-handed. Now, people who are left-handed, there's still a very high rate of people who have left dominance. I think it's about 90%. So even if you're left-handed, there's a very high likelihood that you have dominance in your left hemisphere, meaning that again the right side is not the cause where memory is. Now, with that being said, if you're left-handed, we have tests that we can do of your brain to actually have an even better idea of where your memory is, where your language is. What we do is what's called a WADA test. I don't know, has anyone heard of a WADA test here? Okay, so the WADA test, what it does is we inject a medicine that basically puts half the brain to sleep. So what we do is we go through an artery in the leg, and we go up to the brain, and we inject this medication that puts it to sleep. And first we'll do the one side, so we'll do your right side, and then we'll ask you questions to test your language, we'll test your memory. So we'll show you something, we'll ask you to remember it, then have you tell us what it was. Sometimes what we see is that we can inject both sides, and your memory is average. That's usually what I see. If it's coming from if we're concerned about right side seizures in a left-handed person, what happens, a lot of times the brain is smart, so what happens is that it sees that there's seizures coming from one side, and rather than, it knows that side's not normal, so what it does is it can move the language, it can move the memory to the other side. So it may not be 100%, it may be that you have 50-50, maybe something like that, but we have tests that with the WADA test we can actually see exactly where the seizures come from.
One quick follow-up. And so then you mentioned the right frontal lobe.
What should we expect and what should?
Have you ever had an instance where you did surgery on someone, a left-hander with right temporal lobe epilepsy? His temporal lobe, his right hippocampus getting pounded, by seizures, and also his right frontal lobe getting pounded by seizures. Can you actually do, even though they're on the both sides, same side of the brain, can you actually do surgery on the right frontal end?